Itching, or pruritus, is a lesser known multiple sclerosis symptom, but it still has quite the impact. This type of itching doesn't come from the skin. Pruritus is often neuropathic, meaning it comes from the nerves and is caused by demyelinated nerves that misfire. So, what does neurologic itching feel like? Well, kind of like a burning or tingling or sharp stabbing. And where do you have that itch? Well, depending on the person, it can be anywhere, like the limbs or the torso or the face, and can even sometimes affect symmetrical areas on both sides of the body. Episodes generally last from seconds to minutes, but intense may occur repeatedly throughout the day or disrupt sleep at night. For some folks, pruritus gets triggered by heat or movement. Research shows that neuropathic pruritus may affect around 30 to 35% of people with multiple sclerosis, especially those patients with lesions in the spinal cord or brainstem, and also tends to happen with higher levels of fatigue and heat sensitivity, cog fog, anxiety, or depression. See, the thing is, MS itching doesn't always respond to scratching or topical creams like itching from allergies or rashes. In fact, scratching this specific type of itch may actually increase discomfort or even damage the skin. While all of this is stacked against you, relief is possible. Ways some patients turn down the intensity of this symptom fall into two broad categories: at-home and lifestyle approaches. Cold compresses, like applying a towel wrapped in an ice pack for 10 to 15 minutes, can temporarily soothe the sensation. Loose clothing and skincare, fragrance-free moisturizers, avoiding harsh soaps or hot baths, and wearing breathable fabrics can minimize external irritation. Stress reduction, mindfulness techniques, meditation, cognitive behavioral therapy, and even acupuncture may reduce the severity or frequency of itchy episodes, especially if stress is a trigger. Medical interventions, like neuropathic medications. In severe cases, your doctor may prescribe anticonvulsants like gabapentin, antidepressants, or antihistamines like hydroxyzine, and a review of your disease-modifying therapies. Some injectable or oral MS medications can themselves cause itching or irritation from the injection site. So if you experience these issues, report them to your doctor to see if you might be able to find an alternate therapy. Communicating with your neurologist or MS nurse about pruritus is essential. If your symptoms persist or worsen, especially if they're accompanied by a rash or swelling or breathing problems, that should be addressed as soon as possible so you can keep as much of your skin as possible. Look, while MS-related itching might not be as visible as other symptoms of the condition, its impact on comfort and sleep and emotional well-being can be intense. Understanding how pruritus works neurologically can gear you toward effective relief through self-care, thoughtful pharmacology, and gentle support.